Welcome, everyone. My name is Carl Moronich. I'm Director of Marketing here at Riverside Healthcare, and we're very glad you're able to take time to join us on a very special day. And it's really a special day for a few reasons. One, it's special because this is Hospital Week and Healthcare Week, and it's a time when we get to step back and here at Riverside honor our nearly 3,000 employees for the great work that they do. So let's take a moment, if we can, a round of applause for not only Riverside, but all healthcare workers. Today is also a special day because it's Friday the 13th. And to some people, that's kind of a scary day. But I think after you hear the announcement and what we're going to be talking about, you'll find quickly that it's a very fortunate day for the families in our community. And to get us started, I'm going to call to the podium a man we are all very lucky to have at the helm of Riverside Healthcare, Riverside President and CEO Phil Cambick.
Thank you very much, Carl. So, the big announcement. On behalf of Riverside Medical Center, I am pleased to announce our partnership with the University of Chicago Medicine Comer Children's Hospital to begin offering a pediatric hospitalist program beginning August 1st, 2016 here at Riverside Medical Center. A pediatric hospitalist is a pediatrician who has been specifically trained to treat patients in the hospital setting. This physician works closely with the patient's primary care pediatrician, as well as many specialists who may be part of that patient's care. This growing field is increasingly relied upon by health systems to provide comprehensive, efficient care for our patients. In fact, Riverside has had an adult hospitalist program for the past 15 years. Under this agreement, Comer Pediatric Hospitalists will provide around-the-clock inpatient care to children in the Riverside Pediatric Unit. That care will include consults to the Riverside OB unit, as well as consults to our ED physicians in the Riverside Emergency Department. There's many other benefits that we will explore as time goes on here, but a few of those will allow for our pediatric specialty clinics to happen here at Riverside. So right now, many of our patients in this community, pediatric patients, have to commute up to Chicago. We're going to work with U of C to bring those clinics and those specialists down here, so very excited about that as well. The partnership will also reduce the need for us to transfer as many pediatric patients out of our community. So, patients will still get transferred. University of Chicago Comer Children's does a phenomenal job. They do things that for pediatric patients we'll never be able to do here, but we send out a lot of patients that could be cared for here with the right inpatient care. So I want to work in conjunction with U of C to make that happen. We are confident that the partnership with Comer Children's Hospital will continue to support and even enhance our delivery of quality pediatric care to this area. To get a program like this up and going requires a lot of very hard-working people. So there's a few that I would like to recognize in the audience today. And first and foremost, our local pediatricians. They have done a fantastic job serving this community for a long, long time. As we worked with our pediatricians, they're the ones who came to us and said, we need some additional help. And so they were very, very active in this process, very active in this program. So if you're a pediatrician, please raise your hand and be recognized. Yep. There were also a few key people on Riverside's side who made this happen, and I want to recognize Kyle Benoit, our Vice President of Clinical Services. Kyle really spearheaded this initiative, spearheaded the search process, spearheaded the contract negotiations, spearheaded working with Dr. Ogata from U of C, and has done a fantastic job. So let's give Kyle a round of applause. I also want to specifically recognize Diane McGrath. Diane is the nurse manager of our pediatric unit, does a great job for us, is very excited, but she's the one that really is going to make this work. Right, Diane? And is excited about it. So let's recognize Diane as well. I also want to recognize the U of C team. They were in an evaluation process, and they came to the table and they did a phenomenal job on working with us. A great organization, great reputation. We have had a long history with the University of Chicago from our perinatal network, and we were talking about that earlier. I've been here for 30 years, and I think it's been here since I first started. So a fantastic relationship, but a good organization and good people. So let's give them a round of applause as well. Next, I'd like Dr. John Cunningham, who is chairman of the Department of Pediatrics at the University of Chicago, to come up and say a few words as well.
Thank you very much. It's very nice to be here today. I I came down to Riverside about 2 months ago to start discussing with the Riverside leadership, and particularly with our colleague pediatricians, the nature of a hospitalist program here at Riverside. I think when we all agreed that our principles were aligned. Our principles are that we are a partnership. It's not a large academic center coming and sort of trying to tell people what to do down here, because the care that pediatricians have provided to the community in Kankakee is legendary actually in our own hospital, because over the years many of us at the U of C have taken care of many of the wonderful children that are in the Kankakee community. And in fact, I myself as an oncologist have taken care of several of the children who fortunately have done well from their cancer therapy. We regard ourselves as very fortunate to have Riverside Medical Center, its pediatricians and its physicians overall as partners, and we look forward to building on this first major step. I suppose our first step was 30 years ago when we developed the perinatal network together. Now this next step is to really provide care for every child in this community and providing the most outstanding care, focusing on providing medicine that is at the forefront. So I want to thank everybody in the Riverside leadership, particularly Kyle Benoit, who's been a great partner. He keeps reminding me about Bishop Mack and football. And I can tell you, I've been to Kankakee, I'd say now, for about 6 years, because my son played football for Ignatius, and they got their butts kicked every single time. So I'm coming here in a much better sort of situation now. So I want to thank Kyle. I want to thank the nursing staff. We're looking forward to really having an outstanding relationship with Riverside. Thank you very much.
Thank you, Dr. Cunningham. I also wanted one of our local pediatricians to come up and say a few words as well. So I've asked Dr. Stonewall McChristian. Stonewall's been in the community for some time now, and just a great supporter of the community, to come up and say a few words as well.
Welcome. This process started many years ago as we wanted to improve the services here for pediatrics. You must thank Phil Kamek, his senior leadership, and the board for the support to the pediatric department and their commitment to bring excellent pediatric services here to the community. This process started with meetings, subcommittee meetings, then meetings after we finish in the office. And what you must understand, even Dave Duda stayed for these meetings, which often did not start till 6 o'clock. And you know Dave will have to be out of here by 3. So Dave stayed for these meetings. So you knew how important it was to the hospital that we had Dave and all the senior leadership here at 6 o'clock with the pediatricians to go through this process. The hospital kept the pediatricians involved all throughout the process. We interviewed multiple partners, and I think we came up with the most prestigious and partner that will help us the most and benefit our patients. As we discussed at the pediatric meeting Tuesday, this is for our patients, for our community, to make them better. We are not abandoning you, but making your care better. There were naysayers along the way, but we did it. One thing to remember, only as high as you can reach can you grow. Only as far as you seek can you go. Only as deep as you look can you see. Only as much as you dream can you be. Thank you.
Thank you, Stonewall. The next part of the program is kind of a ceremonial thing, but I'm going to ask Diane McGrath to bring up the certificate consummating the agreement with Riverside and University of Chicago. So Diane, if you can bring it up to us, and Dr. Cunningham and myself will sign it.
A brief but powerful ceremony that has a lot of meaning behind it. So we appreciate all of you taking the time to join us. And it's an important day for care of families in this community, and we appreciate all of you sharing it with us. Thank you very much.